So it's my great pleasure to do a video here looking at some of the data that's come from ASCO. I was at ASCO in Chicago just over a month ago, and so thank you for having me do this this short presentation for Beacon. So we're using a lot of immunotherapy now. It's entered into the standard of care in the metastatic setting of urothelial cancer. The question is, will immunotherapy provide some benefit to use it in a neoadjuvant setting of muscle-invasive TCC? Although the uptake of neoadjuvant chemotherapy is not as high as perhaps we would like it to be, it is currently the standard of care for these patients with muscle-invasive disease. The question is, would immunotherapy provide us with another option? Would it be perhaps less toxic, perhaps the same or more efficacious than chemotherapy? So here were some early stage studies trying to answer this question. This was a study by Necci et al. From Italy, looking at giving 3 cycles of neoadjuvant pembrolizumab in muscle-invasive bladder cancer. Most of the patients enrolled in this were cis-eligible, even though it was open to cis-eligible and cis-ineligible. And they're getting good response rates here. Response rate here of about 40%. And a similar study by Tom Powers, investigator-initiated study, showing this time with atezo, 2 cycles of atezo, restricted to cis-ineligible patients. And there they were getting a response rate of 30%. These response rates are higher than what we get in bladder cancer, in metastatic bladder cancer. Why is that? Because there is already a baseline pathologic complete response rate in patients who get a maximal TURBT before starting their neoadjuvant chemotherapy or neoadjuvant immunotherapy, with the baseline being around about 15%. So these immunotherapies are bumping it up around about to the same level as you can see from patients receiving neoadjuvant chemotherapy. We really don't know how well these data from the immunotherapy of pathologic complete response rates, how it translates yet to overall survival. So I wouldn't encourage anybody to start giving this therapy giving immunotherapy neoadjuvant off trial, for trials for sure, but it's really not standard of care yet, anywhere near standard of care. The question is, what do we think? Do we really think it's going to be standard of care in a few years' time? I'm not quite so sure that it's going to be the standard of care for all patients. If we think in the metastatic setting, chemotherapy has response rates of around about 50%. Immunotherapy has response rates of around about 20%. I'm not so sure that it's going to show us high levels of efficacy in the neoadjuvant setting compared to chemotherapy. Maybe it's going to provide an alternative option for cis-ineligible patients. But I suspect that it may not replace cisplatin-based chemotherapy in the neoadjuvant setting. But that's me just looking into a crystal ball. We need the data to tell us the answer to that.